outwards of the hammer. And the hematose is basically related to two or three complications: osteoporosis, basic malformation of the foot, basic footwear modification changes, and the other things which can get affected by the walking pattern. So in hammer-toe, basically toes goes outwards in a hammer-shaped way. By this going outwards, the pain comes to the fascia area, sole area of the foot, toes area of the foot, and obviously at the hammer area, which is protruding outside. There are so many options, there are so many treatment methods to cure the hammer toe. But if the hammer toe is going up to 10 to 15 millimeters, then surgical intervention is mandatory. There are not as such any specific guidelines for the surgical intervention of the hemato, but hemato can affect your knee, can affect your gait, can affect your walking pattern. So first you have to do footwear modification. Second point which we can do at our home is basic corrective exercises of the foot, which includes calf and hamstring stretch. Third is correction of the foot with correction of the walking pattern. Because due to hammer toe, our walking pattern get affected. We walk like this in a pressure in an inward movement, inside movement. Due to this inside movement, we get affected our hip joint, SI joint, sacroiliac joint, plus back area. So by this, we cannot correct by only making a hemato correction. We have to make correction of our gait, correction of our back area, correction of our knee joint also, including strengthening exercises. First and very important thing of the hemato is to footwear modification. Footwear modification is very much necessary, including sole of the foot. Sole of the foot can be modified with the sole support, with the silicone support, or with the support of anything which is giving rest to the sole, giving rest to the heel and the plantar area. There are so many other specifications of the hammer toe, including plantar fasciitis also. There are so many ways to do color therapy, acupuncture, and acupressure, but we have less evidences of acupressure and acupuncture. But we are having more evidences of color therapy and footwear modification to maintain the hammer toe. So there are so many things. If you have any specific question, then you can write in chat box. So I will address this after this particular session. So today we are going to take a session which is very important for everyone. It is related to our head area. It is related to our conscious area, which is headache. We are going to take headache today. Today it's a complication of the lifestyle is exact headache. The primary and the secondary causes are making us including this. So we have to understand that what are the basic causes of the headache and what are the preventive measure of the headache, including cervicogenic headache. Dr. Neha, can you please allow me to share the content?
Doctor, this volume is not very clear, please.
Yes.
So you
It's
can
not
do
clear?
that, Dr. Dipesh. Yes.
Pardon me?
Yes. So for that, we have to understand the headache, the causes of the headache. Headache are basically of three types. First is primary headache. Second is secondary headache. The third is painful cranial neuropathy or facial pain, or we can say a referred headache. We have to understand the cause of headache in a well manner because If we understand the cause of headache, then we can treat or we can work on that particular route. The primary headache is migraine and tension type headache, which can be addressed by any physician, any general physician, any neurophysician, or the basic therapies, holistic therapies, holistic approaches for the primary headache. They're not going to address any, they're not going to give treatment for any primary headaches. Secondary type of headache, which is psychological, cervical, and due to any infection. It means the root cause of the headache is different, but head is going to give you in trouble. So we have
Cervical
to work
infection.
on basic root cause. Third is painful cranial neuropathy and facial pain. Cranial neuropathy, cranial are the nerves which we are getting supplied by our brain, and the facial pain is also related to one of the cranial nerve, lesion of the cranial nerve where they are getting supplied in our body, and the supplied is related to our conscious mind. Second point is in this, which we have to understand, referral headache and trigger points. These are the trigger points of the headache, which can refer the headache on that red spot area. We have to understand headache first, then we can do so many therapies, so many types of treatment. But here we are giving an explanation of only and only secondary type of headache, which is mainly cervicogenic headache or stress release headache. So in our head, we are basically in our head, we are basically having two types or two compartment of the muscle. First is on right side, second is on left side. In right side and in left side, we have to maintain balance. So from cervical spine to our nose area, from cervical spine to our nose area, we have to maintain a coordination between our muscle. So first, we have to understand the basic spasmodic nature of the cervical muscle. The basic spasmodic nature of the cervical muscle is when you take your finger to rule out the trigger point or to rule out the painful point in our cervical spine, then we have to press our finger like this. If your finger is moving properly and going inside and outside without any bouncy movement and without any pressure movement with no pain, it means you are not having any type of spasm. If you feel any type of pain or you feel any type of spasm over there or any trigger point, it means this point is going to refer a headache. So you have to understand that thing. Including this, you know that our cervical spine is made up of seven areas, which is one, two, three, four, five, six, seven vertebrae. Seven vertebrae supply to our head area, to our facial area, to our upper limbs, to mid back and chest area. So, headache can be associated with our chest pain, with our shoulder pain, with our referred pain in arms, with pain at the scapula or at the shoulder border. So, in this area, we have to check spasm first. So, we will do first a short activity to rule out the spasm, how to rule out, how to check the spasm. For every abnormal thing, we should know the normal thing. If we know the normal thing, then we can easily judge the abnormal thing. In a normal thing, we have to know our muscle texture, we have to know about our muscle quality, we have to feel it, we have to make these fingertips as sensible as our other skin areas of the body. So in this, we will check. the area of the cervical muscles first, then at the skull area or back of the skull area secondly. If we check this area, the pressure from a finger is of basic 1.5 to 2 centimeter depth. We will try to push like we are pushing 1.5 to 2, push pressure, a gentle push pressure towards the cervical spine. This area is paraspinal pressure from down to up. If both the fingers are moving in an equal way, if both the fingers are moving in an equal way, it means it is normal. You're not having any type of spasm. If one is moving in a rigid way or you're feeling any pain at any particular area, it means you are having tender points at that area. This is the definition of the tender point by which you can assess your headache or you can rule out the basic cause of your secondary headache. According to International Headache Society, there are two types of headache, basically primary and secondary. And secondary is further divided into muscular pain, muscular headache, or the pain which is going in your skin area or scalp skin or due to any skin disorder, which is also a secondary type of headache. So we have understood the basic root cause of the headache, basic things of the headache. Now we will talk about the treatment and the home treatment of the secondary headache, especially the cervicogenic headache or the headache which is related to our muscular area and the muscular pains. First, we will do a short activity of tender point assessment on both paraspinal area or the area which is going to address our spine on both the sides. This is paraspinal area. So we can judge this area, we can feel this area by our fingertips by pressing a normal pressure on both the sides from here to the shoulder. We have to check from here to the shoulder, both the sides. So after this activity, we can see or we can rule out our tender points, which is going to associate in our headaches. That was the first thing. Second thing, the treatment part. The treatment part is very important. First, we have to make a balance between both the sides of muscles. If someone is having frozen shoulder, if someone is having heaviness in the shoulder, either on either side, or heaviness at the trapezius area, it means they are more prone to get associated with headache. So first we have to rule out the balance of the both side muscles. By balancing of the both side muscle, we will do a basic exercise to maintain equilibrium on both sides of the skull muscle. This is the center area of a skull. This complete area is center area of our skull. How can we check the balance between both of the side? It is very simple to do a neck movement or neck rotation or bending on either side, on right side and on left side. Which side is affected or which side is more less movement, it means that side is going in spasm. So we have to do basic stretch first on that particular side. For example, I'm bending my neck on right side like this and left side. Left side is lesser movement than right side. Left side is lesser movement than right side. My head is bending on either side. Again, it's moving more on right side. It's moving on less left side. It means my right side is tight. So first I have to give a gentle stretch on my right side. It is a simple stretch. How we will do this stretch? We have to place our opposite hand like this and stretch, 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 and hold it for 10 seconds. One, two, three, 4, 5, 6, 7, 8, 9, 10. This is not a part of cervical exercise. We're just maintaining balance of both the sides of cervical and shoulder muscles to releasing the factors of headache. So we will do like this. We will do a gentle stretch again on this side. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the step one. Now we came to know that my this side is in spasm, or this side is more stiff, or this side is moving lesser on the opposite side. So I will release this with my thumb. As we have studied, as we have practiced in a few sessions, that how to release the tender points and how to do the pressure on that particular area. We will do a gentle release on the affected site. So for that, we will do a gentle stretch behind the ear to this projected bone which is protruding outside. You can palpate this because I'm not going to use any anatomical name or any scientific name of this. You just have to locate that bone, that protruded bone behind the ear is this and stretch with gentle pressure and goes to the trapezius or downwards area like this. It was like this. Remember one important thing that this is not below the ear because below the ear is a different pressure point area. So we are not going to touch below the ear. It is at the protruded bony area with the muscle, with the muscle. That was the second area to release that spasm. That was the second part to release that spasm. Now, the third part, we have to grip that particular area and do a gentle stretch on both the sides. Third step of releasing the spasm of the cervical muscle, which is associating in a headache. We have to grip our muscle area as much as tight we can. We have to just grip, don't need to give any pressure. You have to understand this thing. You have to grip that thing particularly like this. This is the pressure with gripping, and we have to only grip, no pressure. Grip. It's just a grip like this. We will grip like this and give a gentle movement, give a gentle movement on that particular muscle area. You can give a stretch also like this. This is a stretch towards outside. This is also a right method to do this spasm release technique. That was the third part of releasing the spasm of neck muscle. Now, fourth and very important part, which we will see here, is to move your head opposite side. Move your head opposite side. If I'm having spasm or disbalance or stiffness on the right side, then I have to move my head on left side with a gentle stretch at the end. Again, I will explain. We have to give a gentle stretch on the opposite side of the spasm at the end. At the end is very important. It is end range stretch. So I'm doing movement on left side. Now this movement is restricted. I will put my hand on my face and give a gentle pressure with 10-second hold. One, two, three, four, five, six, seven, 8, 9, 10. If you're having more stiffness on your left side, then you can stretch on opposite side. First, we have to give a stretch. We have to give a gentle stretch till end point, till the active range of motion. After the active range of motion, we have to give a gentle end range stretch to that particular motion, to that particular muscle to give the motion. We will do like this on right side. After giving a normal movement, we will give a stretch, hold, one, two, three, 4, 5, 6, 7, 8, 9, 10. These were the important steps to release the tight muscles of the cervical spine for relieving our headache. So we have understood the thing. The point is in the center, 50% contributions are from right side muscle, 50% contribution are from left side muscle. They both plays a equal role to give a circulation, to give a basic connection, to give a basic neurological function to our muscles and skull area from an outer aspect related to the cervical spine, which is also known as secondary headache. So we have given a balance to both sides of the muscle. After giving both side muscle balance, it was 60 and 40 on the both sides, 60 on the left side and 40 on the right side. After giving a basic stretches or basic trigger point release therapy, we came to 50-50. Now the equilibrium has been maintained. The equilibrium is maintained. Now we can move to our next or second grade, which is releasing our headache area, headache reasons or headache points. So we will see this first. What are the points and what are the area of the headache? It was the trigger point area and referral headache. You can correlate this point area. You can touch and give a gentle pressure on these area on both sides and can judge the referral headache if your headache is going like this or shooting like from bottom to upward and in front from backward. So it could be a headache due to trigger point, which is also known as referral headache if it is merging with the nerves. In this trigger point referral area or in this trigger point headache area, we will give a gentle pressure to these trigger points like this, like in a screw manner, clockwise or anti-clockwise. This is trigger point release therapy. We can do with the help of thumb, we can do with the help of pen, we can do with the help of pencil. So I will explain you how to release trigger points at the trapezius area to release our headache at our home setup. So we have to understand the trigger points which we have understood now, the referral areas we have seen of the headache. Now we will do a basic trigger point release therapy. So in trigger points release therapy, we will release our trigger points from up to down. We will start trigger point release from up to down. We will start from our lower cervical area, and end to the shoulder area. In this side, in this basic area, we will see the type of pressure and type of screwing or the releasing of the trigger points. So first we have to maintain a finger in a straight way. We will give a gentle pressure on the particular area behind the ear. If you want to release your trigger point, if you want to locate the particular area, then you can check with two fingers. My ear is here. After the two finger, you can start with the trigger point. That is the first trigger point. This is the first trigger point which we have to release. In this releasing manner, in this releasing pattern, we have to move our finger one side at the clock, one side anti-clockwise. The normal pressure, you don't need to give any extra pressure to these trigger points because they are more prone to the pain. So you just have to give a normal pressure, not excess pressure. It's a gentle pressure to the trigger point. A normal stretch inwards, a pressure, gentle pressure, which was clockwise, then anti-clockwise. 1.1. Second, just leave the area of the tip same as, then take it as the second area. If my first point was here, then second point is leave this second area, then third is my second point. Again, you have to understand if there are total 3 points in a line, we have to pressurize 1, 3, 5, 7 in a different manner to see to locate our tender point pressure mechanism. So we will give a pressure to this area, two finger behind the ear, clockwise one and
Official
second is
dentist.
clockwise.
Biopam.
Second point we have to leave. Then third point clockwise first, then anti-clockwise with a gentle pressure. Fourth point we will leave. And fifth point, gentle pressure on the right side, the gentle pressure on the left side. It was the sixth and
Sorry,
seventh.
20 minutes. Sorry,
Seventh
bad.
is seven is on the right side and on the left side. Eighth and ninth. Ninth point,
बोलो क्लीन
10th,
करते तो पूर्ति
11th,
करने की ऐसे
11th and the 12th and the 13th. You have to move like this. This is a very important manner to release the trigger point. After doing it on a single side, on one side, we will move to the other side. On the other side, we will give a pressure again, two fingers behind the ear. We are giving, will give a gentle pressure in a clockwise,
yeah
anti-clockwise. Leave the second point and take the third point. It is in the continuation.
ईश्वर गोपालना रूम में
Very
टीवी
important
नीचे
thing
છે
we have to understand.
अब
This
ये
is in the
બધા બોક્સ મારે
continuation.
કાઢી
This is
છે ને
not
એવી
in the breaks.
રમકડાને અહીંયા ઢગલો કર્યો તો
First
સરળે
and the
ક્લીન કરી
second, third, fourth, fifth. Fifth is a clockwise, then anti-clockwise. Sixth and seventh, seventh clockwise and anti-clockwise. Eighth, ninth, ninth we have to
make
press.
milkshake and drink
11th we have to press. 12th and 13th we have to press. On an average, every person has 13 to 15 points according to the size of the finger. So these points are really helpful to releasing the headache. Now, next step to release our headache is side bends and side stretches of the neck. First, we have done releasing our neck muscle. We have maintained the equilibrium on 50 to 50% of the side. Next was to release the trigger points. Third and
છે
very
પણ
important is
એમના
exercise
પુત્રને
part.
invite છે ને ઘરે
So on this exercise part, we have to understand a basic mechanism of exercise. We will give first a stretch to the shoulder muscle, then to the cervical muscle, then to
Right.
the scalp muscle or the area of the scalp. First area, second area, and the third area. So if anyone is having headache, so we can start with in the same manner. We can do together to do the exercises. So we will start with the shoulder. We have to understand this quickly. So we will cover it completely. That what is the headache exercise regime which we have made, which we have seen very much effective in lots of patients. So we will do it. Yes. So do with me. First, we will do a shoulder stretch. In this shoulder stretch, we will put a hand on below the neck area. What we were doing in earlier classes that we are doing stretch like this, stretch like this, stretch like this. This is not recommended for headache. For headache, we have specially designed a particular manner of stretching the shoulder or basically trapezius area is to place our hand on upper chest area. On upper chest area. It is very much effective in standing position if you can do in standing. Otherwise, you can do in sitting also. But in supine lying position, it is completely contraindicated. We cannot do in supine lying position. We will place our hand like this. After placing our hand, we will just give a gentle pressure to our chest. After giving gentle pressure to our chest, we will stretch our shoulder backwards. Please see this carefully. This is very important stretch of shoulder because in all types of shoulder stretches, we do shoulder stretch like this, like this, like this. But if you will place your hand on your chest, upper chest area, the shoulder goes down and the stretch goes to your this area. Stretch comes to your this area. So we will do like this. We stretch. Very good. And hold it for 10 seconds. One, two, three, 4, 5, 6, 7, 8, 9, 10. Very good. That was the first step of the shoulder area. Now, second step, which can do headache, which can associated with headache, is to place your hand on shoulder, to place your hand on shoulder and give a gentle stretch like this upward. In this, we have to see our hand on shoulder, that our hand is not moving from our shoulder. One, two, three, 4, 5, 6, 7, 8, 9, 10. This stretch or this particular movement is having no rest or having no hold. On opposite side, one, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the second step of releasing headache. Now we will move towards upside. It was for the shoulder and to stimulate the area which is related to our shoulder blade. Now, third step is to release our trapezius area. Trapezius area, we will do like a side bending. Side bending, we have to understand the bending. This is front bending, this is side bending, this is side middle bending. We will start with the side middle bending. We will start with the side middle bending. After side middle bending, we will give a gentle stretch and hold it for 10 seconds. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then release. On opposite side, not on exact opposite side, in middle. It's a middle side bend. Middle side bend we have done in earlier classes also. It's a middle side bend stretch, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the third step of releasing headache. It was for the side muscle, especially for the sternocleidomastoid muscle, SCM muscle. It was the third part of the stretch. Now we will move towards the fourth part. Fourth part is related to our ear. This is ear stretch. So we have to know the grip of the ear, especially at the older age or in the elderly person. We are not going
Thank you.
Present.
Right.